Good morning, everyone. Today we have Dr. Shakat with us, and he is a practicing implantologist. He's well known in Dubai and international as a speaker. He goes for different lectures, and he is a well known figure among the other implantologists. He has over 20 years of experience, and with his experience, he has placed in numerous numbers of implants. He has also tested most of them out. So I think today's question will be very beneficial for all the doctors and also the patients who will be listening to this video. So, doctor, the question for the day or the topic for the day is: there are lots of implants in the market today. There are branded, there are non-branded, and they all come with different sizes, different shapes, and this is very confusing for most of the doctors as well as for the patients. So it will be nice for you to share some information about the differences between the implants, especially between the branded and non-branded ones, and according to your experience as to what you have seen so far, and what is most beneficial for the patients and also for the doctors.
Thank you, Dr. Salah. This is the most interesting question among implantologists as well as among patients, because everything is titanium and there will be little difference here and there. Either it is titanium or ceramic. Why there is so much difference in these implants? I will tell you, I will start with a small story about this. 2 years ago, there was a test, one experiment in Sharjah University here. So in that test, in that experiment, the participants, they have collected all available implants in this market, including the copy, cheap alternatives, as well as the branded one. And they have done, there was some criteria to do this test. So they have evaluated each and every pieces from the content, from the inside connection and everything. The interesting part is when you take the pieces in your hand, with the naked eye, there are some differences, but it's not that obvious. But when we keep the same thing under the microscope, lot of variation is there. The most striking one, which was giving me answer to so many problems which we have been seeing in the market, is the connection of the implant to that abutment. For the general public, those who are watching this, I will give a small description about the implant. The implant part will be going inside the bone, and the crown will be coming, we will be seeing in the mouth, in the visible area. And there is a piece connecting that crown to the implant. We call it abutment. So this abutment to the implant connection area, when they keep under the microscope, every copy and every cheap alternative implants, it had a micro gap more than 100 micron.
Wow.
That means
more than 100.
That means it's a big, wide, open door for the bacteria to go inside.
Doctor, so will there be these gaps can lead to, if the bacteria is harbored inside these micro gaps, it can lead to gum problems and also bone loss.
Yeah, definitely. That's the thing we have been seeing over the past so many years. Because once this copy started coming out, we know everything is having a copy. Like the phone which we are using, the laptop which we use, everything is having copy alternatives. And somebody is paying the cost of that cheap alternatives. Either it is a patient or it's a doctor, because doctor's reputation will be affected when there are so many failure implants in their practice.
Agree.
And that is very expensive. And we have been seeing so many cases when they place the implant, when they send the patient, after 1, 2, 3 years, there will not be much issues, because the bacteria has to go inside. It has to give the damage to the gum. over a period of time, the bone loss will be very high. Once the bone started losing, then implant will started creating problem. That is the time we were searching which brand we have placed, and they'll be giving big offers and all, lifetime warranty and 20 years warranty, all these things. But when we are searching that brand, they'll be already disappeared from the market. Every branded implants, when they keep it under microscope, there is no such micro gap for the bacteria to go inside. The reason is these implants, they were spending a particular time in the machine. So they can produce only X number of implant because to maintain that quality. At the same time, when it is a cheap alternative, they can produce 10 times more because they don't have to very particularly stick on to that quality. So the production will be more. So they can sell it more. And by the time the complication come, the company is not there. So nobody is there to answer all these things. Nobody is responsible.
So there is no quality control in management in any of the other copies or non-branded implants.
Yes, exactly. And the big issue is when there is a micro gap. All of us know when something is tightly fixed. Some of the implant, some of the well-known branded one, which I am using at present, those branded one, it's having a cold welding mechanism. Once the abutment is inserted into the implant and tightened, these two will be coming as one. Because the microscopic level, it will be welded and it will be very tightly holding each other. And it will be acting like a single piece. So there is no gap for microbacteria, microscopic organisms to go inside. At the same time, when it is a cheap alternative, when the copy implants, the gap is so big, not only the bacteria will go inside, there will be some kind of micro motions because of the gap. That micro motion, what does it do? Once the motion is moving here, there'll be a gap in this area. All the bacteria can go inside. When it is going the other side, whatever is there inside, it can flush out. So the going in and coming out will be at the junction of the gum and the bone. So what will happen? All these toxins, these bacteria toxins, that will be continuously collected there and it will be released outside. So the gum will be very badly damaged. That's the reason when we remove such implants, sometimes for some reasons, maybe the crown changing or some other reasons, or maybe a part of the service when we remove the crown from the implant, we get a lot of bad smell. Otherwise also, the patients, when they're having this kind of implants, they'll be constantly complaining to us, I feel some bad smell in my mouth. I don't know from where it is coming.
True.
Because there is a hole.
We get a lot of patients in our clinic coming to us complaining of these bad smell or bad breath, and there's bleeding gums. And then upon inspection, or we take the X-rays only to identify that there is a gap. And majority of these patients have done their implants not so long ago. And it's kind of surprising to see these kind of cases. And then if we ask them like what, and majority of the patients do know what kind of brands they have placed. And it's confusing for us to know like, oh, okay, if it is that brand, and why these gaps are still there, and why the crown fixing is not there properly. So that this explains, you have given a very good explanation on this one. Very interesting.
Yeah, we in coming videos we'll be going little more detail about this part.
Yes, we would like to hear more about this, doctor. Thank you so much for sharing. It was very informative, and I'm sure that most of the doctors and the patients who are listening to these videos will have a great value and will be able to understand and identify implants. Maybe in the coming videos, we'll be able to, doctor, if you can share the differences between how to identify a copy and an original brand. This is
Definitely.
this will
That
be a
is
very good
that
topic
is
for
one of
me.
my that is one of my favorite topic, and I have been comparing and studying 10 different brands, which is well known, popular in the world, everywhere.
Mhm.
And I was comparing that to the copy one, even though I am not placing any copy of the implant, but I'm getting a lot of cases from a different part of the world.
Nice, nice. Thank you, doctor, for your valuable time.
Thank
I'm
you.
sure,
Thank you
like,
very much.
I have caught you in between patients, so surely we'll keep this video going, and we'll catch up in the next video. All right.
Thank you
Thank you
very
so
much.
much,
Have
doctor.
a nice